Jawline filler. Who isn't a good candidate for this treatment, and what is my preferred filler for this area? Listen now. Jawline filler has become so incredibly popular these days for contouring and defining the lower face. I'm going to walk you through my favorite technique, who I think is a great candidate and who I think is a poor candidate for this treatment, and the dark side of overdoing jawline filler. So stay locked in. Let's start with who is or who isn't a great candidate for jawline filler. Somebody who is a great candidate is somebody like this with mild to moderate laxity in their jawline or their profile that just wants a little bit of a tighter appearing jawline. Let's talk about who isn't a good candidate. Number one, this patient here would not be the best candidate for jawline filler. The severity of the jawline laxity would be better suited for a surgical evaluation. So oftentimes if a patient like this presents in my chair wanting jawline filler, I'll probably refer them out for surgical evaluation. If in the event they're not a candidate for surgery, I have them come back and say, okay, let's try a little jawline filler, but I'm making sure to set the expectations that they're not going to get this snatched jawline. Number two, somebody with dense tissue overlying that mandible, like this patient here. If a patient like this presented in my chair, I would explain to them that the density of their tissue isn't going to allow that filler to work its magic. You can have an unlimited budget, an unlimited amount of products, and I ultimately don't think that they're going to get that crisp, sharp look like they're hoping for, because that dense tissue is kind of going to mask all of that filler and it won't let it work its magic. So typically if a patient presents to my chair with dense mandible tissue, I'll typically focus just on their gonial angle with needle and try to crisp up that gonial angle to give them the illusion of a sharper jawline. Number three, somebody who doesn't have the anatomy to support what their goals are. For example, if a female comes into your chair asking for jawline filler, but maybe she has a more square shaped face already, it's important to explain to her that having a square shaped face by definition is more masculine, and adding jawline filler might end up making her look more masculine versus snatched, which is the goal. So it's important to explain this to our patients that yes, the profile will look beautiful, but it might end up widening that bigonial width, by definition making them look more masculine. Now, with that being said, some of the most beautiful women in the world are more square, like Angelina Jolie. So it's important that we're taking our creative and artistic eye and looking at our patient's unique anatomy to determine what's going to serve this particular patient to get them to their goals. When it comes to my preferred filler for this area, I love Radiesse. It's calcium hydroxyl apatite. It offers structure and stimulates collagen, so it offers that instant definition, but also continued improvement over time. When it comes to my technique, I use needle and cannula. I love the needle that comes in the Radiesse box, the 27 gauge needle. That's my go-to needle for jawline and honestly for a lot of places on the face. 27 gauge needle, I will go with the gonial angle and do a 3-point injection technique on bone, crisping up this gonial angle, and then I will take a 25 gauge by 2-inch cannula and I'll create a porthole right here, inserting deep and go all the way back to the gonial angle and lay a nice retrograde thread of Radiesse there, probably several threads of Radiesse there, and then I'll create another porthole right here, insert up, and right in the preauricular area, inject a little bit of Radiesse there, being really mindful of that parotid gland right there. So you want to be a little more superficial. Sometimes I'll even dilute it down slightly just because this skin can be a little more thin. So just be mindful of that area. Retrograde thread here, retrograde thread in here, and then gonial angle 3-point injection technique with needle. That's typically how I tie the whole jawline together and really define and crisp it up. It's incredibly important to respect the anatomy in this area. Remember, we have the facial artery and we have the marginal mandibular nerve. Remember that facial artery tracks out of that antegonial notch that sits on the anterior part of the masseter. So when you clench down, you find the anterior border of that masseter. That antegonial notch is sitting anterior to that, and that's where that facial artery is going to track out of. You want to be incredibly mindful and respectful of this artery, and typically that's why I use cannula when injecting the body of the mandible. With all of that being said, managing expectations is absolutely key. Filler can do a lot of things, but it also has a lot of limitations. So setting a realistic plan with your patient and working together to come up with that plan is what's incredibly important. And to tie it all together, it's so incredibly important that we're doing a thorough evaluation consultation with our patient to determine if they're even right for this particular treatment, making sure that we're respecting anatomy, choosing a beautiful product for this area of injection, and making sure that our technique is on point to make sure that we're delivering beautiful results that really crisp and define the jawline for our patients.